The third fundamental principle is professional competence and due care. Professional competence and due care has two requirements. The first relates to professional knowledge. Professional knowledge has two further sub-requirements. The first is to obtain professional knowledge which can be done through the completion of an accredited degree and the successful completion of courses like the CPA Program. The second requires members to maintain their professional knowledge. This can be achieved by complying with the Continuous Professional Development or CPD requirements to ensure that members are up to date with the latest technical and professional developments. The second requirement of professional competence and due care is to act diligently. This basically means that professional accountants must act to the best of their ability and to not be negligent in the performance of their duties and responsibilities. For example, assume that doctors were taught that the best treatment for a rare blood disease called beta was to prescribe drug A. In the last 2 years, research indicated that drug A had a number of negative side effects. Subsequent to the research, new drugs called drug B and drug C were found to be much more effective in the treatment of the beta disease. Sally qualified 3 years ago and did not attend training where these new drugs were discussed. Sally recently had a patient who tested positive for the beta disease, and Sally prescribed drug A to this patient. How has the fundamental principle of professional competence and due care been breached by Sally's actions? First, in terms of professional knowledge, Sally should have attended training that would indicate the new treatment for the beta disease. By not doing so, she failed to maintain her professional knowledge and thus was not up to date with the latest technical developments in the medical profession. In terms of the requirement to act diligently, treating a patient with a disease that she is not technically up to date with can be argued to be negligent on her part. She should have referred the patient to another doctor who specializes in the beta disease.